Hi, I'm Kevin Flood, President and CEO of the LSU Health Shreveport Foundation. LSU Health Shreveport is committed to improving health disparities across our region and beyond. That's why I want to invite you to join me at our upcoming Healthcare Workforce Conference happening February 17th and 18th. At this conference, you'll learn innovative ways to develop inclusive educational programming for your students. So please visit the website today and register for the conference. We'll see you there.
Join us February 17th and 18th, 2025 for the Healthcare Workforce Conference and Benefit Dinner. This dynamic event brings together leaders in higher education from across the southern United States. Discover strategies to empower student success, foster strategic partnerships, and create equitable opportunities for aspiring medical and biomedical professionals. Don't miss this opportunity to make a lasting impact.
Hi, I'm Kevin Flood, President and CEO of the LSU Health Shreveport Foundation. LSU Health Shreveport is committed to improving health disparities across our region and beyond. That's why I want to invite you to join me at our upcoming Healthcare Workforce Conference happening February 17th and 18th. At this conference, you'll learn innovative ways to develop inclusive educational programming for your students. So please visit the website today and register for the conference. We'll see you there.
Join us February 17th and 18th, 2025 for the Healthcare Workforce Conference and Benefit Dinner. This dynamic event brings together leaders in higher education from across the southern United States. Discover strategies to empower student success, foster strategic partnerships, and create equitable opportunities for aspiring medical and biomedical professionals. Don't miss this opportunity to make a lasting impact.
Good afternoon, good evening, everyone. My name is Dr. Toni Thibeaux, and I serve in the role as Assistant Vice Chancellor for Student and Community Engagement at LSU Health Shreveport. Look, I am so excited that you've taken a little time out of your schedule to join us this evening as we begin to promote to the virtual world the healthcare conference that we're excited to be able to share with the Shreveport-Bossier community, which will impact the Southern United States. And so I want to take some time to be able to talk about the need for the conference, the impact of the conference, and how it will change and and move the healthcare industry. One of the main focuses of the conference is to foster some positive partnerships, as well as create some opportunities for us to engage in conversations about how we can impact the healthcare workforce in the state of Louisiana. In doing so, we want to focus a little bit on designing programs and working in this partnership mode to improve and empower students to be successful. As we talk about the dynamics of healthcare disparities and educational gaps and achievement gaps that exist in the Southern region, it's going to be critically important for healthcare professionals as well as educators who thrive in our positions to recruit some of the most phenomenal students in the state of Louisiana, of how we can do better in promoting success. And so the conference tonight is set aside for some of the speakers and panelists and sponsors to engage in some conversations to encourage you to register for the conference. We're bringing in some national speakers, and so we're looking to attract those physicians and nurses and professors in higher education, local cattle parish school teachers and high school counselors and principals most definitely could benefit from registering and attending the conference. STEM educators, those individuals that are working with our school-age children, as well as those enrolled in post-secondary schools on science, technology, engineering, and math careers. Here at LSU Health Shreveport, we have numerous programs in place to prepare students to be more competitive as applicants. And so we want to make sure that we're working with our community partners to create programs such as this healthcare conference that are going to benefit both the state of Louisiana and those learners in our classrooms. And so I would like for you to continue to engage with us. You can do so Facebook at LSU Health Shreveport, our Instagram, of course, at LSU Health Shreveport, even our YouTube. And look, during, after, and even tomorrow, we encourage you to visit the website to gain more information about the healthcare workforce. Help me to promote this using the hashtag HealthWorkCon25. That's our hashtag. Help me to push this critical and very much needed conference for us to engage in conversations of what we can do as educators at medical institutions and flagship campuses of better preparing the future workforce. Our sponsors most definitely would like to pause. One of our key partners is the AAMC. We also have Christian Shreveport Healthcare System as one of our sponsors. We have some departments internally, our internal stakeholders. I most definitely want to pause and say thank you to Dr. Zurab, who is the department chair for OBGYN. I most definitely want to thank my colleague and one of my top tier allies, Dr. Sharon Dunn, who's the Vice Chancellor of Administration and the Dean of the School of Allied Health. And there is another one that I promise you I will remember who that person is, but we could not be able to carry out this event without the support of our internal and external stakeholders. So I most definitely appreciate your effort in helping LSU Health Shreveport be able to make this conference available to individuals in the Southern United States. I have with me tonight, joining me, our panelists are coming on. I have Karen Washington, who I will allow her to introduce herself, her affiliate that she works for, as well as her role, and of course that ally that I was speaking of on the campus, Dr. Sharon Dunn. So if we could pause and maybe shift so that those individuals could introduce themselves, that would be great.
Hello, everyone. I am Karen Washington. I am the program manager and administrator for internal medicine residency program at Texas Health Resources Presbyterian Dallas campus. And I am just thrilled to be here tonight to help promote this event. I'm looking forward to attending it and hearing everybody's input and learning some new things and how to strategize for my program as well.
Thank you, Dr. Thibeaux. I'm thrilled to be here with you tonight to promote this conference. My name is Sharon Dunn, and I'm the Dean of the School of Allied Health Professions here at LSU Health Shreveport. And I'm also the Vice Chancellor of Academic Administration on our campus. One of the things that I've learned as a physical therapist by clinical training is that there are a lot of professions in healthcare that probably match young people's personality in a way that they'll be engaged and inspired throughout their careers. When I was in high school, I didn't know physical therapy existed. I accidentally fell on it with an experience with a friend that was studying it in the southern part of the state. I ended up meeting them at a football game of all things, and she talked to me about her career in physical therapy, and I was like, "That's it." I knew I wanted to do something in the medical field, and that was 40 years ago. And we still have a challenging time connecting young people to health careers. Well, that's what this conference is set up to do, to introduce high school and undergraduate career counselors to people in these health fields across the country to inspire young people to identify with one of these health professions that they can have a lifelong and an inspiring career in. So thank you, Toni, for inviting me to be a part. I look forward to the conference and seeing who we can partner with to create pipelines into these health professions and partnerships across the country that we might not leave one kid behind who sees themselves as a health professional, but they'll be connected to a multitude of options. So thank you for putting on this virtual teaser so that people can understand more what the conference is about. And I look forward to interacting with many of the people who are in this audience and then those who decide to come to the conference.
Thank you. I saw that Dr. Gutha Kanda is joining us. I am so excited to see him as well. So he may be having some, no, there he is. Dr. Gutha Kanda, thank you so much for taking time out of your busy schedule. Dr. Gutha Kanda is a phenomenal surgeon here at LSU Health Shreveport and one of my allies here on the campus. He has been He's been very kind to my department, very supportive of the department and the students that we serve. He's been critical when it comes to mentoring students who have an interest in allied health professions as well as medicine. And I want to pause and most definitely acknowledge your your allyship here on our campus, and to give you an opportunity to share with our viewing audience why you feel a conference of such that we're hosting is needed and the impact that you believe it could have on the LSU health community and the state of Louisiana.
Thank you, Dr. Thibeaux. Can everyone hear me fine?
Yes, we can.
Okay. Thank you so much for including me in this and for all that you're doing the last several years for the institution. I think the conference itself is going to be an amazing experience for all the students and other healthcare related professionals that can be a part of it. It's entertaining. I think it's very, very eye-opening. The diversity of speakers and presentations that you'll have access to is really unparalleled. And I think it really does highlight every walk of life in healthcare will be represented. And like Dr. Dunn said, I mean, I think it really highlights people from all kinds of backgrounds, all kinds of locations within the country, small towns, big cities, the North, the West, the South, all over America. I think people work in this one, special setting. And I think it really will give anybody who's a part of it a lot of inspiration and really will show, that you can kind of do anything that you put your mind to. And I think the opportunities exist. Um, like Dr. Thibeaux said, it's been a pleasure for myself and several in my department to be a part of some of the summer programs where high school and undergraduate students who are interested in some form of healthcare. Even though I'm one of the physicians here, we take students who come to us. They know that they want to be a nurse, or they know that they want to be a physical therapist, or they want to be a PA, or they want to be a doctor. And I think all of those students really have just a unique opportunity, and hopefully a conference like this where a lot of that information will be available in a very condensed and friendly, enjoyable setting will give all of the attendees and the attendees' families, the attendees' friends, a real good insight into this. So, I really congratulate you, Dr. Thibeaux, for what you've been able to do, and thank you again for including me as a small part of this.
You are welcome. Thank you, thank you, thank you. The panelists have mentioned some very unique characteristics about this upcoming conference, and you've heard them mention the pipeline programs that we have across all of our three schools. And so I think what I'd like to do is maybe give some of you some background about LSU Health Shreveport. We are the medical school in North Louisiana. And so we're making some progressive waves. I would like to think of how we recruit and retain our students to graduate and to move in the healthcare setting. So our campus is made of three schools. That's going to be the School of Medicine. Dr. Dunn's present for the School of Allied Health, and then Graduate Studies. And so this campus is equipped where we can most definitely mold and shape the next group of healthcare workers. I mean, we have it right here in the Shreveport Bossier area, and we are working together, our senior leadership team, the medical education program, Sharon Dunn and the School of Allied Health. We're really, really working collectively to design programs such as this healthcare conference to make a difference in the city of Shreveport. When we begin to talk about, recruitment, we are not only selling LSU Health Shreveport. I remind everybody of that every time I begin to talk about recruitment. I am not out talking to students just about LSU Health Shreveport. I am talking about Shreveport, Louisiana, and what does it have to offer. We're competing for a small number of students who are applying to medical schools and grad schools and the School of Allied Health Professions across the United States. We most definitely want to be able to retain those students who have lived and learned in the state of Louisiana. So how do we best do that? We do that with building these partnerships. That means every faculty advisor, every STEM advisor that I know in the state of Louisiana, paraprofessionals, program directors, recruiters, college administrators, academic affairs. We all have a responsibility to come together and work together. What works best for us. I can tell you what those requirements are for medical school, for LSU Health Shreveport. Sharon Dunn and her team can, tell you what our requirements are for the 7 or 8 different programs that they have over in the School of Allied Health. Jason Bodley and his team over in the School of Research most definitely can tell you those academic metrics that are necessary, but we must come together as a community That's the whole southern region. When we began to talk about health disparities, and that's why I have this MD and Sharon Dunn and our representative from Texas Health, when we began to talk about those health disparities and the gaps that exist and the challenges and the barriers that students have, even in making the right decision prior to applying to our programs, it is going to take a group effort, a sincere, authentic group effort to provide these students, prospective students, with the information that they need to be successful. Once we make them strong candidates, what do we do when they're on our campus? How do we keep them motivated? Right? How do we motivate them to perform at their personal best? These are conversations that we're going to have at the conference. Our admissions requirements need to be shared with you, those STEM and faculty advisors at the undergrad level. We want you to come in so that we can have those conversations and tell you what we are looking for in those students. How culturally sensitive do we need to be to students from different backgrounds? That is a huge barrier when we begin to talk about how do we bring communities together. That means individuals from different background, different beliefs, different perspectives, and put them in a learning environment where they can learn from one another and to become better healthcare workforce individuals. Dr. Dunn and I have this conversation all the time. If there's anyone more sensitive about this, it is most definitely Dr. Dunn, because we're in this office trying to figure out what can we do? How can we make our teams better? And when we're talking about our teams, we mean our teams that extend outside of the LSU Health Shreveport community. So if you are out there tonight and you work for Southern University Shreveport, and you work for Bossier Parish Community College, and you work for the Northwest Technical College, we want to encourage you to visit our website and register for this conference. That information is being made available to you on the screen. We encourage you to register now. I have worked really hard to bring in national speakers to engage with the LSU Health community. We have Dr. Marquita Wills, who is going to visit our campus twice. She will visit the LSU Health Shreveport community and give a lecture earlier that day, and she is the keynote speaker for the benefit dinner that will take place at the conclusion of the conference. We're so excited to have her. A plenary speaker is Dr. Virginia Kane. She will also be present at the benefit dinner. Dr. Kane is the newly appointed president of the National Medical Association. I said the National Medical Association. Dr. Wills is from the American Psychiatric Association. That's two national speakers coming to LSU Health Shreveport. You have no idea how excited I was to tell the chancellor about that, and anybody else I could share that information with, that we have individuals at the national levels who believe in the programs that LSU Health Shreveport has in place. They understand the need for this conference, and they want to be part of our community February 17th and 18th as we engage with you, those individuals working in those positions across the Southern United States who want to come to LSU Health Shreveport and have the dialogue, the critically needed dialogue of what our responsibilities are in creating the next pool of applicants and graduates to fill the healthcare workforce. So I am excited. I'm excited. I have to stop. Everybody on here knows that I talk a lot. You know, they give me a script and I try to stay as close to the script as possible. But when you have a desire to really motivate students to learn, I believe the three panelists that are joining me understands that feeling. We come in and we give 200% of our work. It's 7:30, approaching 7:30, and I'm still in the office. I'm going to do any and everything that I can to put us on the radar. And that's what this conference is about, putting LSU Health Shreveport on the radar as a medical school right here in North Louisiana, where we can recruit students from the colleges and universities here in our area to be the very, very best. Okay.
Hey, Dr. Thibeaux, one of the things that you and Dr. Gutakonda mentioned were the pipeline programs. And many times students aren't aware of the professions that are available to them until they actually are immersed in it to be aware of what they could do with a career in healthcare. And that's part of what is driving this conference is creating opportunities to get the word out about the many health professions, and many times it's because these individuals have not had access to health care if they are represented in an underserved group. And so sharing the different professions and what's available in a career in these professions is important, but also having academic advisors who can counsel and direct young people to these professions. But I think we'll get an opportunity to talk about our pipelines at this conference. But I'm really looking forward to learning what other people do to create immersive experiences so young people can even have awareness of these professions. Dr. Gutakonda, my question to you is, how did you learn about neurosurgery before you aspired to become a neurosurgeon?
I actually, when I went to medical school, I was pretty sure I was going to become a pediatrician. I would have put money on it, in fact. And I happened to go to medical school in New York State, and I went to a school where all of us did 3 weeks of neurosurgery as a requirement. I had never seen, a neurosurgery. I had really no knowledge about it. Never would have thought I would have done it. And I ended up doing that rotation, and which every student did at that time at my medical school, which was in Syracuse. And I think because of that, I just really liked it. I liked the variety of things that were done, and I liked the people I was working with at that time too, which I think is a big component of it. And so I did a little bit more after that, and to make sure it's really what I liked, and then ended up going into it. And I think, like we've mentioned, I think these experiences that the students have exposure to, pretty much every student that we ever take in the summer has certainly never seen a neurosurgery. And so they come and they get a chance to spend time with us in the clinic. They spend time in our research labs. They spend time in the OR, and every once in a while they like the radiology that we see, so they go into that, or they like the neurology, but they're not so interested in surgery, and they go into neurology, and sometimes they see physical therapy in the wards, and they gravitate towards that. So I think just like with me, if you're not really exposed to something, you might never really have the chance to see whether or not you like it. And I think these opportunities, especially these pipeline programs, really provide not just a day or two, but they spend several weeks in a row with us. And so they spend time with us, they spend time with our residents, they spend time in our front office. And I think they really get to see and be a part of everything. And we love having the students in the summer. So
Awesome, awesome. Look, we're going to take a commercial break. I think that's a great time for us to pause, and we're going to come back and we're going to hear a little bit more from Karen Washington. Dr. Gutha Konda said something very important, about the medical education program and then the residency program. And so I'd like to bring Karen in after our commercial break to talk about the importance of having this conference and how it impacts even the resident component. So we'll be back shortly.
Hi, I'm Kevin Flood, President and CEO of the LSU Health Shreveport Foundation. LSU Health Shreveport is committed to improving health disparities across our region and beyond. That's why I want to invite you to join me at our upcoming Healthcare Workforce Conference happening February 17th and 18th. At this conference, you'll learn innovative ways to develop inclusive educational programming for your students. So please visit the website today and register for the conference. We'll see you there.
Join us February 17th and 18th, 2025 for the Healthcare Workforce Conference and Benefit Dinner. This dynamic event brings together leaders in higher education from across the southern United States. Discover strategies to empower student success, foster strategic partnerships, and create equitable opportunities for aspiring medical and biomedical professionals. Don't miss this opportunity to make a lasting impact.
All righty, so we are back live in action. I hope you guys are actually enjoying the conversation and the dialogue that we're having here tonight, and want to reemphasize to you the importance of, I want to say the opportunity to encourage you to take advantage of this conference. So we would want you to visit the website, register to attend. You've heard some words and comforting notes from Dr. Sharon Dunn, who's the Assistant Vice Chancellor of Administration, as well as the Dean of the School of Allied Health. We have one of our top neurosurgeons here joining us, Dr. Gupta Kanda, who's talked about the importance of providing early exposure to our students, to help them decide what it is that they want to be when they grow up, right? We need to come together in the state of Louisiana across multitudes of campuses to figure out the best strategies to put in place on our campus to attract and retain these students in the state of Louisiana. If you are visiting with us tonight and you are not in the state of Louisiana, but you're in the southern region, I want to encourage you. Sharon said it best: bring your ideas, bring what's working for your campus. We want to foster positive relationships. You know, we can't do that if we don't communicate with one another. We want to figure out ways of how we can strengthen the workforce pipeline. Every school has their challenges. We know that that's no hidden secret, and every campus has their strengths. So we need to be able to come together, share our strength and our weaknesses that will benefit the students here in the state of Louisiana. So as I said, we have Karen Washington, who is in Dallas. Karen will be registering for the conference, and she shared that information and had it pushed out through the Texas health system there in the state of Texas. You know, Karen, you work on the residency side when it comes particularly to medical school. So from your perspective, I'd like to give you an opportunity to talk about the importance of this conference and the impact that you see.
Great. Again, thank you for having me tonight. Well, I'm a product of Southern University and LSU Health Science Center in Shreveport. I've worked there for years before coming to Texas. And this conference, I think, is very important because the conversation goes on not only from students looking to figure out what they want to do in allied health, but moving beyond that to when you become a healthcare professional and figuring out what your niche is going to be and how you can better serve your community. And I think that it's important that someone like me during my residency program and with the residents, talking about community outreach and talking about healthcare disparities and what role do they want to play in learning how to be an advocate for their patients. And it doesn't just mean physicians as well. As a former radiology tech, advocating for my patients, I had to learn how to do that when it came to simple things as telling them how to, communicate better with their nurses if they were having problems. So it's important to have that communication and learning how to communicate with your patients and help your patients learn how to communicate with their healthcare providers. The community partnerships go beyond just Louisiana, moving into Texas. We're right here, we're neighboring. And we're neighboring communities, and we kind of intermingle. People move across the state lines, of course, all the time. And so being an asset as far as that, and knowing what your niche is and what you want to do, no matter what healthcare multifaceted healthcare thing that you want to do, or position that you want to be in. But right now we're in a time where advocacy and knowing the laws and things that are being passed that are going to affect not only us but our patients is very important. So I think that learning with this conference how to navigate helping residents figure out what their niche is, because even though I'm doing internal medicine, I do have residents that are not sure what they want, what their subspecialty should be, and they're trying to get their footing and figure out, do they want to do GI or cardiology? Do they want to work in a rural setting or become a hospitalist? So those are choices that they are having to navigate as well when they are in residency. But starting out as a strong medical student is very important, and having that support from medical school and beyond, it makes a real big difference on having a strong foundation and knowing who you are and what motivates you as a healthcare professional. What gets you going in the morning when you get up? What do you want to do? Get you excited, and how can you affect what you're going to do for the day, your patients, your colleagues, your hospital, your clinic settings, things of that nature, your staff, your supporting staff. All of that comes into play, whether you are a physician, a radiology tech, a laboratory tech. Everybody works together to make better health care for our patients and for our families and ourselves. So, I'm really looking forward to this conference to get ideas and hear what everybody else is going through, and how to navigate certain conversations with medical students and residents alike, and also colleagues, fellow program directors and physicians, faculty, and keeping everyone motivated and seeing their programs in their departments being successful.
Awesome, awesome, awesome. Thank you so much, Karen. Dr. Dunn, I think this is a great time to loop you back in. We've been talking about the partnerships, and we've been talking about, how we can do better as professionals to motivate students to be at their personal best, because we want them to be successful in that academic setting, right? We want them to pass their boards, and we want them to go out, and we want them to save the world, right? They want to do it, and we've motivated them to do so. So I'd like to hear from you and Dr. Gutha about the impact the conference can have on health outcomes. Louisiana has some poor health statistics. right? We are all aware of that. The structure of this conference includes those conversations, and one of our guest speakers is actually the chief medical officer at the Louisiana Department of Health, Dr. McGee, and she's going to talk about the disparities that exist in the state of Louisiana. But as we work close together, she's there on the stage. She's going to be one of our presenters, and I believe her moderator is actually the Assistant Dean of Graduate Medical Education, James Morris, here on our campus. And so the information that the two of these individuals, the insight that they can bring about the health disparities that exist in Louisiana impacts our work. It should give us a different set of energy to make sure that we are educating and we are advising and counseling those students to be best. So what is your take on the conference and the impact that it could have on health outcomes that impact the state of Louisiana, Dr. Dunn?
Thank you, Dr. Thibeaux. I have a heart for our communities, and that means everyone. And, y'all means all y'all from a Southern dialect perspective. And we learned a lot. There have been many challenges that all of us have weathered over the last 5 years. That COVID pandemic being one, where health disparities became such a beacon in the data that we were seeing as people were um, having access to healthcare, to access to information, to life-saving interventions and treatments. And so I think the conference will allow us from several different parts of the country and health systems to compare notes about how we learned about health disparities and what we did to mitigate some of the health disparities in our different communities. So I look forward to learning that from some of our partners in the conference. The healthcare workforce pipeline is also critical because we have a societal obligation to replenish, and some of us will be retiring soon, and we need a robust future health profession workforce to come in to answer that societal obligation to provide health care to all y'all. and and that includes having a healthcare workforce that looks like and shares experience with all y'all. So I look forward to learning how other institutions assure that healthcare workforce pipeline is robust and diverse. And so that's what I'm looking forward to learning at the conference and sharing what we do. Another thing that we've done in the School of Allied Health Professions is take student success and retention seriously. So any student that's admitted to our programs, we want to make sure that they graduate on time and are successful in their board exam preparation so that they can enter the workforce as soon as possible. So what are other institutions' strategies at student success and retention? Because I know we have a strategy, and Miss Jennifer Smith is our director of student success. She'll
Mhm.
be at the conference, but I'm sure she will enjoy engaging with other partners across the southern United States and sharing notes and collaborating for what makes for a great outcome of the academic endeavor that we're all involved in.
All righty. Our marketing agency is giving me the prompts that I need. So look, let's take a quick commercial break, and we're going to come back and we're going to hear from Dr. Gutha Kanda and how he feels the conference will impact the health outcomes in the state of Louisiana. And I am super excited that Mr. Marco French was able to log on. I'm going to give Marco an opportunity to tell us a little bit about his background. Marco is doing phenomenal work when it comes to educating our school-age children. You know, when we begin to talk about pipeline programs and early exposure, that goes all the way back to kindergarten. And we have some phenomenal individuals here in the state of Louisiana, right here in Shreveport, who are educating our children and working with LSU Health Shreveport to make sure that we close some of these educational and achievement gaps. We'll be right back. Let's take this commercial break.
Hi, I'm Kevin Flood, President and CEO of the LSU Health Shreveport Foundation. LSU Health Shreveport is committed to improving health disparities across our region and beyond. That's why I want to invite you to join me at our upcoming Healthcare Workforce Conference happening February 17th and 18th. At this conference, you'll learn innovative ways to develop inclusive educational programming for your students. So please visit the website today and register for the conference. We'll see you there.
Join us February 17th and 18th, 2025 for the Healthcare Workforce Conference and Benefit Dinner. This dynamic event brings together leaders in higher education from across the southern United States. Discover strategies to empower student success, foster strategic partnerships, and create equitable opportunities for aspiring medical and biomedical professionals. Don't miss this opportunity to make a lasting impact.
All righty, we are back. Look, we need for you to register. We need for you to register for this conference. It is going to be a wonderful learning opportunity. Everybody is coming into this setting as a learner. Hashtag HealthWorkCon25. Help us to promote this conference. Register now. You can scan the barcodes. You can go to our website, lsuhs.edu/HealthWorkCon25. We want to see you here. Our sponsors, couldn't do this without our sponsors. One of our key partners is the AAMC, as well as the Christian Shreveport Bossier Health System. I have two of our internal sponsors here on our campus. One of our department chairs, Dr. Gupta Kanda from the Department of Neurosurgery, correct me if I'm wrong, neurosurgery. And we have Dr. Sharon Dunn, who is the Vice Chancellor of Administration and Dean of the School of Allied Health. I did not realize that we are almost at our time slot. So I know that I was going to bring Dr. Gupta Kanda back on to talk about those health outcomes, but please allow me an opportunity. I do know that Mr. French was having some problems logging on. So Marco, if you would introduce yourself to our virtual audience, let them know about the magnificent work you are doing with those school-age children and how your work aligns with what LSU Health Shreveport is doing. I think everyone needs to have a clear understanding that the work starts long before those students apply to our medical school program. And Mr. French could give you more information.
Well, good evening to everyone. Such a pleasure to be here. Thank you all for having me. Marco French, 16 years in education now. And as she just mentioned, it starts early, you all. Boots on the ground early. And I'm talking about pre-K, you're starting there. And when we think about the health disparities that we have in education in those lower performing neighborhoods, looking at the socioeconomic status of those students, the parents, it's so important that they have a broad understanding of the health benefits or the outcomes that they have and things that are available to them. And I look at that as educating the whole child. It's just not about academics. We have to educate the whole child from their lifestyle, the way you live, the choices you make, and the academics. Because if you don't have a healthy child or you don't have a healthy body, the academics seem to fall by the wayside. So again, educating the whole child is one thing that I believe wholeheartedly in. And like I said, it starts as early as pre-K, teaching those healthy habits, whether it's how you eat, informing parents on what's available to them in the neighborhood, in the surrounding areas, in the city of Shreveport, what is available to them for their health and their children's health. And the one main area that we work on as early as in the K-12 sector starts with mental health. You know, having awareness of your mental health and the choices that you make for your health itself, whether it's the way you eat, exercising, or as children get older and progress through middle school, and they're starting elementary now, but middle and high school, those choices that you make, that deals with, how would I put this? Just how things you do in life. And when we talk about life, we're talking about teaching all those areas of health that deals with children whole, just all around. But again, things we're doing at the elementary level as we start there in the school level, just having kids to be informed. Not only being informed, we also want to inform them of the careers that they can have in the healthcare system. So therefore, it is wonderful that those children have those opportunities, one, to be exposed to the knowledge, the resources, but also to show what they can actually be, how they can actually take part in the healthcare workforce, whether it's them being doctors, pediatricians, any of those things. And because when they study to become aware of those areas, they're also studying to see how they can benefit their selves and families. So again, it starts early, early.
Yes, yes, yes. And so you are now you've worked for Caddo Parish in the past, but you are now working in a more rural area of the Claiborne Parish. Is that correct,
Yes,
Marco?
correct. Very rural. And when I compared the two of Claiborne and Caddo, the things that the students, the staff that they are afforded and have accessibility to, is totally different. You don't have that in Claiborne Parish. Very rural. You have maybe one hospital. That's Home Memorial Hospital right there. Your next closest hospital is in Minden, in Webster Parish. So them being able to see the intricate pieces of allied health and anything like that is very slim to none. But to have those partners with LSU is wonderful. LSU Shreveport, it is wonderful to see that they can actually help their sister, who's a part of the AHIC program, and then she was a part of the all medical program that took place. They only accepted 12 students in the whole region. Yeah. And she was accepted every year to go to Baton Rouge. So for our students to have that opportunity, they don't have to go away to Baton Rouge. They can come right to Shreveport and have the same experience. So I'm super excited that our students will have this outlet, and me being one of the faces to actually push that in Claiborne Parish.
Yes. Marco, you mentioned AHEC, and so I most definitely want to push and promote Dr. Wanda Thomas. Dr. Thomas is the Associate Dean for admissions here on our campus, but she is also, let me make sure I get this title correct. Wanda is also the president of the National AHEC organization. We have that person, the national president of AHEC here on our campus at LSU Health Shreveport. She is going to lead the discussions about admissions, and her moderator is going to be our chief counsel, Mr. Carranza Pryor. So when I tell you that I have worked very closely with our institutional effectiveness executive director, Mr. Jeff Howells, to make sure that the strategies and the goals that we have established for this program align with our accrediting requirements. That's what we've done. That's how this conference was shaped and molded. It is intentional. It is intentional, and it is required for us to meet these standards. And the conference is not about meeting a benchmark. The conference is about finding the most applicable way where every school across the southern region has an opportunity to gain a better understanding of what LSU Health Shreveport is trying to do. Remember, we have three schools: School of Medicine, School of Allied Health, and Graduate Studies. We have three major schools on this campus that can make a significant difference in the percentage and number of students that we recruit, retain, and graduate and push into that workforce pipeline. We need your help. We need for you to join us February 17th, 18th. Register for the conference February 17th and 18th. Deadline to register for the conference is February 6th. We need to have all registration completed by February 6th. Remember the hashtag HealthWorkCon25. Health Work Con 25. Register now. We need your help. The students in Shreveport, Bossier, Coshado, Claiborne, Arkansas, Mississippi, Grand Prairie. Right. Look, if you are a physician, if you are a nurse, if you are an academic professor, if you are an allied health professional, faculty advisor, program director, STEM educators, workforce development, look, do not want to end without letting you know our plenary, one of our plenary speakers is actually Miss Tracy Jackson. I'm not quite sure if I've pushed this information. I did. Tracy Jackson is coming in from the state, Indiana. Indiana is where she is coming from. She has been working in workforce development for over 25 years. And Tracy is excited to be able to travel to the state of Louisiana to share with us what's working up there that we may not be able to, that we may not be doing here that we can capitalize off of. And so we have extended our reach. I am so excited about this conference. I want to take the opportunity to thank Dr. Don, Karen, and Dr. Guthakonda for spending these last 50 minutes with me as we promote this most needed conference. Marco is here. He is actually an honoree at the conference. Marco French is actually, we want to recommend and acknowledge to him the work that he's doing and how it impacts our programming here at LSU Health Shreveport. Another individual that we will honor is Miss Keisha Simmons, who has a background in counseling. She also has a nonprofit organization that is doing phenomenal work here in the state of Louisiana for first generation students. And so it's our external partners, those individuals with nonprofit organizations who are working relentlessly to mold and shape students and partnering with us to make better students, to make stronger students. So I want to say thank you so much. I'm going to ask somebody to talk to me in that chat box to see if we have any questions from individuals who have maybe been joining us the last 45 minutes. Oh,
And-
no, actually 57 minutes. I'm sorry. I'm sorry. It's 7:57.
And Dr. Thibeaux, as you're looking at the chat, if somebody's wondering what an allied health professional is, do you mind if I list out what might be
Yes.
considered an allied health professional? That includes physician assistants, that includes speech and language pathologists, respiratory therapists, medical laboratory scientists. We also have cardiovascular technologists trained in our school, occupational therapists, physical therapists. We have a nursing presence on our campus. We have public health. So all of these professions are represented within allied health professions, and it gives a variety of options for students who already probably know about physicians and nursing. There's a lot out there, so I wanted to make sure anybody who might have been in the listening earshot know that we have lots of options. We also will have medical research represented at this conference with Dr. Bodley in the School of Graduate Studies. So there's a lot to have exposure to if you're an advisor in an undergraduate school or a high school, or even all the way down to pre-K. That you'll learn about what it takes to become one of these professions so you can guide that future healthcare workforce appropriately. Thanks
Awesome.
for that opportunity, Dr.
You
Thibeaux.
are welcome. You're welcome, Dr. Dunn. So where will the event take place? You know, so we've been talking about February 17th and February 18th. We had a huge grand opening of the medical education building here on our campus at LSU Health Shreveport. And so we have a phenomenal new facility with large size auditoriums with high tech engineering in place, and we are happy to be able to host the conference on our campus in our new facility. So registration, when you go in, you'll get a little bit more information, but it will take place on the LSU Health Shreveport campus. That's on Kings Highway. Don't get it confused with our flagship campus on Uri Drive. It's on Kings Highway, across from the subway and the eye clinic. If you're confused, but we're going to host it in our new medical education building. Dr. Dunn, help me with this. One of our viewers want to know how many students are in the LSU Health Shreveport system. We can probably give you the number of students we have here at LSU Health Shreveport. We don't know about that system, but I think we roughly have maybe between all three schools, is it about 1,500 students, Dr. Dunn?
That's a good estimate. At any time, we have about 350 students enrolled in allied health, and I know the School of Medicine enrolls 150 students a year. So I think your estimate is right on when you include the School of Graduate Studies as well.
Alrighty. What states are included in the southern region? Look, we're talking. If you want to call yourself Southern that day because you want to benefit from this conference, we're inviting you as well. But as Karen mentioned earlier, we're talking Louisiana, Arkansas, Mississippi, Texas. We hitting Tennessee area. That whole just southern claps up in there, right? So if you fall within that region, you are most definitely invited. Look, one of the roles in my job is to make sure that there are some inclusionary practices. So just because we are focusing on the southern region does not exclude anyone from participating in this conference. As you can tell, our plenary speaker is not from the state of Louisiana. The bringing in of different perspectives adds value to any dialogue. So if you're viewing this conference via LinkedIn or Facebook, we want you to know, if you have an interest in this conference, that you are most definitely invited to attend. I think that's all the questions we have in the conference. I want to most definitely once again thank those individuals who have spent the last hour listening to the panel. I want to thank the panel again. That's Dr. Sharon Dunn, Assistant Vice Chancellor for Administration and Dean of the School of Allied Health, one of our champions for my office, my hero. That's what I'm going to begin to call him. There is never a time that I send Dr. Guthakonda and ask for a request that he has not supported me. And it's really important that you let your colleagues know what that means to you. And I want you to know that that really means a lot to me and my team, Dr. Guthakonda, that you and your department are always ready to help us move the needle on anything. So once again, thank you. We have Miss Karen Washington, who is working in that Texas area, helping to cultivate a new set of residents. Karen, thank you so much. I know that we have all worked all day. And Karen, I can only imagine the traffic you were in trying to get to a spot to log on. So I want you to know that I greatly appreciate your effort to push this conference out in the state of Louisiana. That Texas health system is huge. That's a huge system, and I'm hoping that they feel invited and included enough where they'll take advantage. Marco, keep doing what you're doing. Keep doing what you're doing and molding the minds of our small children. We're looking for strong educators in that K through 12 age group to help us identify those competitive students, and even catching those students who may not be as competitive and getting them on the right track. That's part of the discussion as well. So look, thank you all. I want to thank our marketing team, Mr. Brent Latin. Brent, I appreciate you in more ways than one. Help me to continue to push this conference out here. And thank you, the viewers, once again. But most importantly, don't forget hashtag HealthWorkCon25. Register for the conference. Register for the conference. Visit our web pages, Facebook page at LSU Health Shreveport, Instagram at LSU Health Shreveport, YouTube, and our website. We want you to be able to take advantage of this conference. Scan the barcode if you can catch it real fast and register for the conference. I hope to see you there. Thank you so much and have a great night.
Thank you.
Hi, I'm Kevin Flood, President and CEO of the LSU Health Shreveport Foundation. LSU Health Shreveport is committed to improving health disparities across our region and beyond. That's why I want to invite you to join me at our upcoming Healthcare Workforce Conference happening February 17th and 18th. At this conference, you'll learn innovative ways to develop inclusive educational programming for your students. So please visit the website today and register for the conference. We'll see you there.